morning, depending on where you are today. Thank you so much for joining the National Complete Streets Coalition and Smart Growth America on our webinar on Complete Streets responses to COVID-19. I'm really lucky to be joined here by four amazing speakers who I think are going to wave hello right now before they take their webcams off till they present. But thank you, all four of you, for joining us. For those of you who don't know me, my name is Emiko Atherton. I am the Vice President for Thriving Communities at Smart Growth America, and I am also the Director of the National Complete Streets Coalition, which is a coalition of organizations committed to really building transportation systems for all users of all abilities. Next slide. Today we're here to talk about Complete Streets responses to COVID-19, but I did want to highlight that the National Complete Streets Coalition is part of Smart Growth America, and we have a COVID-19 resource page where you can really figure out a lot of the things that we're working on. Advocacy, our sister program, Transportation for America, has really led a lot of efforts to make sure that transit agencies stay alive and continue to provide access to jobs and other essential services during this challenging time. We also have other webinars that we'll be hosting, lessons learned from the last stimulus about recovery and infrastructure. So I encourage everyone to go there. And then if you have not seen, next slide, we do have a map that the National Complete Streets Coalition has been working on, really crowdsourced from all of you, where we're putting together all of the actions that we're seeing communities take that are using transportation to respond to COVID-19. And this is really what inspired the webinar today. So the webinar today, you're going to hear from four leaders who are working both in their communities and throughout North America to make sure that people have space to physically distance, that they can access their jobs and other essential services, and that they can generally maintain and live in open space during these challenging times. I'm going to start off by welcoming Mike Lydon, who I think all of you can see up in the upper left-hand screen. And before I introduce Mike, I do want to say that if you have any questions, we will have time for questions and answers at the end. Please put them into your questions chat box, and we will see those and make sure that our speakers see those in the last 10 minutes where we have Q&A. But I want to start off by introducing Mike, who's joining us from New York today, from Brooklyn. Mike is a founding principal of Street Plans and leads the firm's New York City office. Mike is the creator of the Open Streets Project and the globally acclaimed series of digital productions, Tactical Urbanism, Short-Term Action, Long-Term Change, volumes 1 through 5. Mike is also the co-author of the Smart Growth Manual with Tony Garcia. Mike is the recipient of the 2017 Seaside Prize and co-author of Tactical Urbanism, named by Plantagen as one of the top planning books of the past decade. The same news site named Lydon as one of the top 100 most influential urbanists of all time. I also just think Mike is a visionary leader who has really been watching and helping communities during COVID-19 use tactical urbanism and open streets to respond to COVID-19. So with that, Mike, I'll turn it over to you.
Great, thank you, Emiko. You can see from my picture there, I've got a little bit of a quarantine haircut going on these days. All right, so let me advance the slide. I am not able to advance the slide, unfortunately. Cole, if you're able to help, that would be great. There we go. Okay, forward. All right, so I'm gonna move quickly here. I'm still unable to advance the slide. Cole, are you able to give me control? All right, maybe I'll just advance the slide through voice. So tactical urbanism, I think a lot of you listeners know about this approach to project delivery. I think what we're seeing a lot of now in cities is being put underneath that banner, so to speak. And I'm here to kind of ask that question, as well as share with you some of the tactics that are being utilized and whether or not these are intended to lead to long-term change, and how we might catalyze some of the responses to COVID-19 to create that change that we were looking to undertake in our cities regardless or before we had this pandemic to deal with. Next slide. There we go. So in Brooklyn, in New York City, we've been pretty hard hit by this. This is around the corner from where I live, and it really kind of sets the mood for how life in the city feels right now. It's a very challenging time. In New York in particular, we are constrained by, high density and not a lot of open space, particularly if you are in a number of neighborhoods where you don't have big green spaces to go and find yourself, room to roam around, or even just feeling a lot of stress taking our transit system, which most New Yorkers typically do, or just walking around the streets. We've got narrow sidewalks and a lot of people need to get to work, needing to get to essential services, and of course to get some exercise and open space. So it's been a pretty stressful time in New York City. Next slide. We've seen, from starting about 5 weeks ago, a number of cities take this head on or not, and what to do about the challenge of space in urban areas. We've seen two very basic responses. One kind of typified what you see there on the left with Chicago, is that a number of cities have said, look, we don't feel comfortable, it's not safe, we don't have the resources, we don't want to put that strain on our city officials and our citizens to be out, sharing the public realm. And so some cities have done, most cities, I should say, have done almost nothing or limiting or preventing access to things like trails and parks and greenways, beaches, etc. Whereas other cities have looked to their streets at this moment. Denver and many others, which we'll share some examples of today, are actually creating open space using the street network, which tends to be the most amount of open space available, if not dominated by motor vehicles. So it's been a very creative evolution, I would say, in cities to look to those streets and to think about them more than just a one-day closure, which is common, or a block party or an open streets event, to make this a resource that's available to people across the city. Next slide. So we've been documenting this pretty closely with a spreadsheet and analyzing how cities have been managing this crisis through their streets. And really, we've got about a typology that includes 6 different types of measures. Next. I'll walk you through these very quickly. There's the open streets, which is full closures of streets to motor vehicle traffic, except for emergency access. A number of cities, in fact, the majority of cities on our, in our database, had taken this tactic, and this really started to happen at first as a response to just shut down spaces in parks or along waterfronts and give people access. Next. There's an image of what that looks like in Denver. Next. Some neighborhoods are not, don't have open space or open streets. So other citizens, people have been taking, control of their own blocks and closing those down to cars for time of day access for people just living in residential communities. And there's a number of people who've done that without sanctioned permission in cities. Next. So here's an example from Portland, Oregon. Next. Open curbs has been applied a few different ways. They're removing on-street parking, or if there's a curb travel lane, dedicating that back as expanded pedestrian space. Sometimes used for movement, other times used for queuing or access to storefronts, like grocery stores when sidewalks are relatively narrow. There's a number of examples of this around the country and across the globe. Next. So there's a quick example from Calgary. Next. Shared streets. This is something that happened, really with Oakland and Burlington, Vermont, a few weeks ago. Before that, it was really the open streets or open curbs. But now we're seeing a growing trend of cities taking on a kind of hybrid approach where you're allowing local access for residents on their blocks, but you're discouraging through traffic. And this has actually resulted in miles and miles of open spaces across, dozens of cities now. And that's really an exciting, I think, approach, because it really shows you how very minor changes can change the psychology of the street and give people permission to utilize it in a number of different ways, including just for physical exercise with proper physical distancing at this time. Next. An example from Oakland. Next. Temporary bikeways. We've seen huge surge in bike use in many cities across the globe as people are no longer taking buses or subways or other surface transit in terms of trying to prevent the spread of the COVID-19. And so you see cities saying, hey, how can we close gaps in the network or provide access for people who need to move around the city at this time? And so Berlin, New York, Paris has made a big announcement, and many others are going to be adding miles and miles of bikeways that are temporary in nature, but it can also be transformed into more permanent installations later on. Next. This is downtown Brooklyn. Next. And finally, there's putting signals on recall for pedestrians, meaning that you no longer have to press that annoying little big button. I'd say the second most popular response to COVID-19 in terms of streets and managing streets has been this tactic. So it's been very common in cities large and small across the globe. Next. Next. So we have a map that's linked to our database, which is like many organizations right now, tracking a lot of these different initiatives. You can check in on that, and there's a link to it at the spreadsheet, which is at the end of this presentation. But you can see how global this is starting to become. Next. And at a high level, in terms of when we're looking at cities right now, we see 107 plus cities that have taken actions in their streets. So I'm not talking about policies per se, but just taking physical space and reappointing it for a variety of different uses across 17 countries using those 6 tactics with 141 different applications. So we're seeing a lot of cities actually start to diversify what they're doing and not just relying on open streets or not just shared streets, but doing a number of things to respond to the pandemic, which has been an interesting development in the last couple of weeks. Now you can see the breakdown. Next. In terms of mileage, cities across the globe, you've got Paris, who just committed to a little over 400 miles of bikeways to be built at first temporarily and then more permanently across the entire Paris metropolitan region. That's obviously off the charts, as you can see. But Lima, New York City just announced 100 miles today, which they're committing to from the mayor. Oakland's doing about 74, Quito, and then Auckland, Burlington, Vermont, Minneapolis, Milan, and Barcelona round out the top 10. Of course, all cities are a bit different and have different resources and different needs at this time. So next slide, please. It's pretty remarkable to see that actually about a third of all the cities are small in nature who are engaging in this. So I just gave you some big city examples. Cities are finding ways to make this work for them at their scale and with the resources that are present. In fact, we're finding that many small cities, although may not have the resources of a New York, are actually much more nimble in their ability to make some of these changes and don't have to go through so many channels in government to get these things done. So Burlington, Vermont stands out because they've got measures now on 25% of their street network. That's pretty remarkable. It's a city of 42,000 people, and now 1 out of 4 street miles, you'll find some sort of intervention at this time. And then Carborough, North Carolina is the smallest city that we found that's made changes, and they're a community of about 20,000 people. So it's cities large and small who are engaging in these responses. Next. I'm going to end very quickly here with what we've learned and what we can pull away from this this trend so far. We're finding that leadership and responsiveness beyond just the greater pandemic related to the streets is also really critical. Taking a leadership position from mayors and councilors to think creatively and think quickly has been essential to get some of these changes in place at a time when resources are really strained. We've seen cities looking to leverage existing programs. Do they already have an open streets? Do they have a citywide block party permit? Are there ways they could leverage their policies and programs to allow for these spaces? So a number of cities are doing exactly that and looking to those plans to give them guidance on where to make the biggest impact first. Next. Open streets have been, the most common in waterfronts and in parks. Of course, the challenge there is not everyone has easy access to those spaces, but Philadelphia is one of the first movers on that. Number 4, cities with in-house capacity for materials and traffic control have been the best set up to succeed. So those actually have cones in the warehouse and barricades and signs they can print or have on hand to install and be able to move quickly. Other cities usually contract that out, and it's been more and more challenging for those cities to respond, even though they see the need, the resources to hire those contractors, or even the staffing to manage, and then the contractors themselves has been difficult to get things implemented. So in-house capacity has been absolutely key so far. Next. Again, those materials are pretty basic. We're talking cones, signs, freestanding delineators. Sometimes cities are using those variable message boards, the digital ones. But the key point is we're thinking movable, quick, cheap, flexible, in the street, out of the street, try things, et cetera. Very, very at the heart of tactical urbanism. And again, we see cities, small, mid-size, are just as capable as the larger ones to lean on their existing plans if they have them in their leadership and to move forward. So again, you see the example there of Burlington. Next slide. Robin will tell you a lot more about Minneapolis, but there has been a lot of iteration there and evaluation of what's working, what's not. The Minneapolis kind of rose to the top very quickly in North America in terms of closing down streets to vehicles to give them space for people. And so they've made some changes in their routes and adjusted as they've been going and diversifying their approach. And that's been really exciting to see from an analysis standpoint. The troubleshooting and thinking about behavior management was one of the big concerns for cities and why they haven't closed down their streets. But what we've seen is that's not really been an issue at any meaningful scale yet, which has been really important, I think, to show you can have trust in your citizens at this moment, and citizens are hopefully able to trust their government to help them make those right decisions and provide the space and resources for them to be able to move through the community at this challenging time. Next slide. Of course, some cities are trying to do this bottom up. So in DC and many others, you've seen that action taken, and then the city responding once it's able to find the resources and organize itself. So it's kind of interesting to see how citizens have started on some tactics, but then cities have adopted them and moved them forward once they've got their organization able to do so. There have definitely been a lot of missed opportunities across the globe. I think there's too little focus right now on equity in terms of applying these measures where they are likely needed most. So you see there a map of New York City. You can see the outer edges of the city are much more impacted by the pandemic, and these are exactly the neighborhoods we're going to find more of these essential workers, people traveling longer distances to get to hospitals, to drive ambulances. These are bus drivers and train transit operators, and we are not seeing necessarily at scale, and both in New York and other places, those places being prioritized first. So that's been a mistake, I think. Moving forward, we're going to need to look at schools, other open spaces, neighborhoods that don't have that access, and prioritize those areas to make sure that we're installing open streets and a number of these measures to be more equitable across the board. I think it's only one example we've come across that's actually even targeted hospitals, and that's in Wollongong, Australia. So thinking about streets around hospitals is really important at this time as well. Next slide. And finally, cities are really expanding these responses upon the initial step that they've taken, and they're now transitioning into what they're looking at as the new normal. So now that we've cleared so many streets of crushing traffic, there's this opportunity to think about what comes next and what kind of city do we want. And so I think the next 4 to 8 weeks are going to be really critical in thinking through how these very temporary means, in terms of the flexi signs and the cones, get transitioned either out of the street and things go back to normal, or we use this opportunity to totally reimagine and how we manage and design our streets to maybe not invite as many cars and as much pollution, as much inequity back into our streets. So that's going to be something to track in the coming weeks for sure. Next slide. Next slide. And so the question is, are we up to this task? Can we rethink our cities at this critical time, not just to be resilient the next time we might have to face something like this, because that's going to be absolutely critical, but to manage and deal with the ongoing stresses that our cities have all the time in terms of public health, in terms of access to open space, in terms of transportation resources. There's a lot of ways that this moment can be a time for cities to step up and go to the next level and really start to thrive from a mobility and public space perspective. So I think with that, because of the slow slides here, I've gone a little bit over time, so I will hand it back over to Emiko to keep us moving. Thank you. Emiko, you're on mute.
Thanks so much. Well, this is all work in progress for us, right? And I was going to say thanks so much, Mike. I know we went through those slides at the end pretty quickly that share Mike's resources, but we will make sure that those are sent out, and we'll share all of Mike's great information right here, and you can check more about it right on the screen. Mike set up Robin really well by talking about leadership and some of the great things that Minneapolis is doing. And so I'm really fortunate to be able to introduce Robin Hutchinson, who's the Director of Public Works for the City of Minneapolis. Robin was already really a leader in transportation, but we've certainly seen this shine through during her work on open streets and transportation in Minneapolis during COVID-19. Overall, as I mentioned, Robin's a leader, and her work focuses on leveraging the public right-of-way investments for broader outcomes, such as a focus on climate response and resiliency. Prior to coming to Minneapolis, she was Director of Transportation for Salt Lake City, Utah, where she implemented transportation projects of all types, including the revamping of the city's parking and signal timing systems, the construction of the city's first streetcar, which is phenomenal, numerous pedestrian safety projects, and the expansion of the city's bicycling program. Robin is also the president of the board of directors for NACTO, which is the National Association of City Transportation Officials, which if you haven't heard from them, you should. Right after this webinar, go ahead to the NACTO website and their transportation response to COVID-19 resource center. And NACTO is an association of 81 major North American cities and transit agencies formed to exchange transportation ideas, insights, and practices. And with that, I'll hand it over to you, Robin.
Thank you so much for that really generous introduction. And thanks for the opportunity to talk a little bit about what's happening in Minneapolis. I'm going to start by saying I'm on this webinar to share information from not just the city of Minneapolis, but there are other agencies and organizations who have led to any success that we're having in opening up our streets for more opportunities. I'm going to try and advance the slides as I was instructed, and it is also not working for me. So if you could go to the next slide and then to the next one. One more. Everything we're doing today in Minneapolis is rooted in the development of our Transportation Action Plan, which is an update to a 10-year-old plan. Every time we think about a street today and what we want to do and all of the opportunities we want to create during COVID, we can harken back to the very foundation of what we're trying to do for long-term change. Just like every other city, our right-of-way is a lot of space, a lot of area, a lot of land area in our city. It's 22%. There's places for people, they're invaluable assets, and that's what they are today during COVID. They reflect our values and they create a more sustainable and equitable and safe and prosperous city. Everything we're doing today meets these goals. You can go to the next slide. So within that overarching vision for what we want our streets and our right-of-way to do, we're really focused on climate, safety, equity, prosperity, mobility, and active partnerships. And I'm going to walk through some of the changes that we've made, both by City of Minneapolis and also by the Park Board of the City of Minneapolis, which is a little bit separate. I'll explain. Everything can relate back to one of these essential goals that is within our draft Transportation Action Plan. You can go to the next slide. So the examples that I'm going to show you, they leverage partnerships, they create safer spaces for people, they support economic prosperity, providing equitable outcomes. And I want to say these last few, I am hopeful that it will accelerate the long-term outcomes that are noted in our action plan. You can go to the next slide. So here's a comprehensive map of Minneapolis and all of the measures we have in place today, almost all of the measures we have in place today. A few are difficult to map. And I'll start by explaining the green lines kind of around the perimeter and then fill in with the blue lines that were just announced today. The green lines around the perimeter primarily represent or reflect the changes that were made by the Minneapolis Park and Recreation Board. They are a standalone commission of the city, and they were incredible leaders. So the superintendent of parks, Al Bangora, was the first person to have this idea and to get it done very quickly and showed tremendous leadership. There's incredible staff there, and they worked quickly first on a couple miles, and they expanded, then they expanded. And that was a catalyst for the city. That was a catalyst for us to say, how can we fill in and make it even better? So the second thing we did was there are some smaller segments that are reflected here that show connection to the larger opportunity. And just today, we announced some interior loop opportunities for slower streets, healthy streets for our residents. You can go to the next slide. I will come back to this map. So let's talk a bit about what created the framework and this concept of loops. The Grand Rounds goes back to the 1890s in the city of Minneapolis. There were some very smart landscape architects that laid out a quote unquote round of green opportunity for people to enjoy natural spaces and outdoors. And that's in place today, was developed all the way through 70s and 80s, and there are gaps in it. And what I'm showing you here is that most of the Grand Rounds and most of the opportunities is on the perimeter of the city. So most of the opportunity that the Park Board was able to open up is on the perimeter of the city. Wonderful opportunities, but not accessible to everybody. You can go to the next slide. So here's some, I think I have one or two images of the streets that are opened up through the parks. So here's one. You can go to the next slide. There may only be one. I can't. Yep, there's another one. This is called the West River Parkway. This is adjacent to the Mississippi River. And you can go to the next slide. Okay, so I'm switching gears now. When we looked at that initial network, we, the city of Minneapolis, tried to create spaces that did a few things, that used our streets. These have been in place for a couple of weeks. And what we wanted to do is first try to connect people to the opportunities, the multiple miles of opportunities that had been created. But we also wanted to take into account, this is a popular grocery store, where people might need to have more space to access what they typically would during any given day. So we began to open up more space within our own streets, just using, as Mike said, very easy, quick build materials. And we opened up pretty quickly about 5 miles of space. And this is where, as Mike mentioned, we're doing a lot of review right now. Some have been very heavily utilized, others not as much. So we're in a process of adjusting. You can go to the next slide. Just another example of extending sidewalk space. We're having a bit of an internal discussion on whether we're going to move the bollard out to the outside of the bike lane, or we're going to think of it more as an extension of the sidewalk and keep the bike lane just as is. Likely we'll make that change, but we're discussing. You can go to the next slide. And just an example, if it's not being used, we may not keep it, but we're going to give this one a little more time. Next slide. Okay, so a couple bigger pieces of information that we've just shared today with our community. And the first is a pretty long and connected opportunity between numerous agencies. So on the right side of the map is the city of St. Paul, actually, the city of St. Paul. Again, the city of Minneapolis didn't do any of this alone. We did it in collaboration with so many. So city of St. Paul is on the right side of the map, connected to the West River Parkway, which is in Minneapolis and part of the park system. And then the city of Minneapolis has been working with and negotiating with both counties, Ramsey County and Hennepin County, and the city will be placing some bollards out on the bridges that connect. So hopefully by the end of this week, hopefully by middle of this week, we're going to have a 6-mile and 10-mile loop between both Minneapolis and St. Paul that will have dedicated space for walking and biking. This is an exciting opportunity because people are, this is a beloved space for people in the Twin Cities. So very exciting to have more extended opportunities, a lot more mileage for people to take advantage of. You can go to the next slide. We also announced today 3 interior loops in the city of Minneapolis where it will be local traffic only. We've called these Stay Healthy Streets. This is an additional 11 miles of opportunity for our residents. And every single segment that is shown in blue on this map is also a proposal in the Transportation Action Plan for our All Ages and Abilities Network for walking and for bicycling. So we're introducing this concept that will hopefully have a long-term benefit and calls right back to our Transportation Action Plan. And you can go to the next slide. I'm trying to keep us short and on time. Just a close-up of those and providing a little more information to our residents. How long would it take you to walk the whole thing? How long would it take you to bike the whole thing? These will go in on Wednesday, starting on Wednesday this week. And next. Okay, a couple other things that are harder to map. We are one of the cities who have automated our signals, no reason to push the button. We have about 800 signals. Many of those already were did not have push buttons, so we've changed almost all of the remaining 400 to remove the need to push the button. I will say this was important to us. You still can push the button, and that is for ADA accessibility and making sure someone who's sight impaired still pushes the button and still gets the audible to cross. So a little clunky on the messaging there, but important that people who still need to push the button can push the button. You can go to the next slide. So back to our goals. Most of what I've described has been about safety and climate, promoting other ways of transportation. This thing that we've done that many communities have done, we took the first cue from Seattle, is really about prosperity. So using our space to support businesses. Within 2 days' time, we had almost 60 permits issued to install these food pickup only zones in front of restaurants who are really trying to make it right now in every community. Can go to the next slide. Okay, I'm just going to switch gears and I'm going to close out by saying, as we're making fast changes right now to support people where they are during COVID, we also have our eye on our 2020 work program, because our 2020 work program, where we just set it aside and do everything new for COVID, we would miss major opportunities to make improvements that people have been waiting for that support our overall goals. And one of them is lowering the speed limits. We obtained authority to do this. We're in the process. We should be done posting and lowering our speed limits throughout the city of Minneapolis by the end of October, and our work presses on because all the changes that we're making on our streets right now are supported by the lower speed limits that will be in place by the end of October. You can go to the next slide. And some other things that we have in our work program: converting space. We've got plans to install more bikeways. We don't want to set that aside. We want to accelerate that, and potentially looking at whether we should be looking at more bus-only lanes starting this summer to prepare for transit's triumphant return. You can go to the next slide, and I think that was the last one. The last one just says thanks. Thanks so much for the opportunity. We are learning along and making a lot of adaptations. Every single community is different. Every community is going to have a different response, but I will say this: we are all learning from each other. So the opportunity to hear from other folks and participate in the conversation is invaluable. Thanks.
Mike.
Thank you. I'm going to keep doing that. I was just saying thank you, Robin, so much for your leadership. Really inspiring. And I know the work that you've done in Minneapolis, and you and your department and all of the partners has inspired cities across the world. Next, I have the pleasure of introducing Keith Benjamin, who is also just such a leader and someone I would say I met, I think, in my first week at the National Complete Streets Coalition. And it's just been a joy to watch his leadership extend, I think, from DC to across the country and now in Charleston, where he's been the director of traffic and transportation for the city of Charleston, South Carolina for just shy of 3 years.
Yeah.
And in this position, Keith oversees all transportation maintenance, planning, and partnerships at the local, county, and state level. He represents Charleston on multiple boards, and I know is also known for his national leadership, talking about transportation and transportation equity and innovation. So Keith, I'm going to hand it over to you to really talk about how a smaller southeastern city is using transportation to respond to COVID.
Thank you, Uncle. And it's good to be with family and have these conversations and happy to have this discussion and represent the South. Charleston is a wonderful place and a historic place. It's actually our 350th anniversary this year. This is also a city that was the epicenter of the transatlantic slave trade and the first city to have historic preservation. And so we're in a city that has ambered its history, but also wrestles with it regularly. And it kind of permeates every aspect of how we engage community, what community looks like, and how did that affect people on a daily basis. Pre-COVID-19, our growth in the community just quite frankly been astronomical. Our job growth rate is about 4 times the national average. Our population growth rate is about 3 times the national average. We've had a huge influx of millennial population, about 60% in the last 10 years. And just a lot of business and industry that's in our area. We have the fastest growing port system, smallest airport with direct flights to London because of all the various different companies and otherwise that are here. And so there's been this bearing of a question of what does smart growth look like? What does resiliency look like? What does housing affordability look like? And what does transportation look like? And that's kind of been at the forefront of our minds. If you do not know, the average Charlestonian spends about a third of their income on housing and about another 15% for transportation. The backbone to our community is food and beverage, and that community has been hit hard. And in a significant way, especially as it pertains to accessibility. Charleston is not just our peninsula where most people come to visit, it's 5 different boroughs. And if you are in the food, beverage, hospitality industry, only about 19 or so % of them live downtown. And they make an average about $23,000 a year. So if you don't have a car, you're relegated to some other modes or connection of modes of transportation just to get to work. And sometimes that's not as safe. Our transit system has a high dependency ridership. There's a lot of change we're making within our transit system, but over 70% of our riders make $45,000 or less. And then on the safety side, we are #1 in the state, unfortunately, both city and county, and bike ped death and injuries are about 43% of them are Black. We're #2 for speed fatalities, we're #5 for DUIs. And so in 2018, we passed the first citywide transportation plan in our city's history, which included an urban bikeway system for our entire peninsula, and really have been zeroed in on how we shift the department that I've been tasked to oversee. My predecessor was in place for about 30 years to think differently about being an implementation chair. And I'll speak about that a little bit later because that's a major cultural shift for us. The other piece is really 2 major stakes that are in the ground regarding transportation that we were zeroed in on pre-COVID-19. 2 major transportation projects, a $400 million bus rapid transit system that's going to connect Somerville 26 miles into downtown, into our medical district, our largest regional employer, and then a $20 million bike and pedestrian bridge that we got through the Bill Grant last year to connect West Ashley and our 12-mile greenway and bikeway into our downtown corridor. And so we've been engaged in this conversation about what does transportation look like for our community, for a Southern community, for a historically preserved community, for a community that has well over 80% individual car ridership dependency. And how do we address that in a significant way? And though COVID came, we could not ignore what those priorities were. How do we continue to engage in that work, and also what those opportunities are, even in the midst of some complexities that are a little bit different than some of our big brother and sister communities that they deal with regularly. I'll just lift up 3 quick points because I know we want to get to questions and otherwise, and of things that we've been doing in Charleston and ways in which we've been engaging. The first thing I have to say on behalf of my 60 employees is that we have prioritized the safety and well-being of all of our workers. I have signal crews, signs and marking crew members, parking enforcement, permitting and inspectors and otherwise. And it's impossible to talk about this conversation of how we're going to build community. What does that look like? How do we dedicate the public right of way and the very people who are helping to do that, many of which, at least from my city, are actually from Charleston, making sure that they're safe, that they're able to engage, that they're able to make sure that their well-being is taken care of. And so that has been top priority for us. We can't say that essential work needs to continue and not prioritize their safety. And so that's been on top of mind for us. The second piece is that we didn't try to find answers on our own. I think sometimes I think it can sometimes be a prideful thing of like, we as a city got to figure it out ourselves. We got to come up with our own idea. The beautiful thing about communities like this with the Smart Growth America National Complete Streets Coalition, with NACDO, who we're one of the babies in that community, is that I could pick up the phone, I could send a text, I could tweet to somebody and find out, how did you do that? What exactly did that look like? And so there's a number of things that we're currently doing that we're engaged in that I really can't take credit for. It's because we've been watching and learning and seeing what that looks like. The automation of we have over 200 signals in our city. We are responsible to maintain and operate them on behalf of the state DOT. About a fourth of them had pedestrian push button signals. We automated all of those. I saw other cities doing it. It was like, that's an easy lift. Let's make that happen. Did it through our brand new traffic management center. We've expedited intersection improvement projects we've been doing with the state DOT. We saw that we shouldn't hold off on being able to get work done, but instead move the needle forward on what exactly that looks like. We transformed our parking enforcement officers into ambassadors for our city, that they could be at varying different areas throughout our city, nearby parks and otherwise, and make sure that people are able to have an ease of accessibility, especially through non-motorized access, but be able to safely social distance as well. We adapted our transit system to make sure that dependent riders were still able to get to their basic needs. Many, as I mentioned earlier, about the average salary of those who take our ridership, the vast majority of our ridership also does not have a car. And so when you talk about getting to food access, getting to health access, we needed to be conscious of those particular routes that, even though it might be on a different type of schedule, we might have to adapt and add those lines to the schedule simply because there's communities that that's their only way to be able to get to their basic needs. And then on the mayor's behalf, we formed a internal group with our police department, our parks, our recreation, our livability team, and also my team to begin to have a conversation about what open streets looks like for Charleston. It's different from city to city. We have over 100 parks within our city. Many of them have various different roadways that traverse through them. And so we're having some strategic conversations about completely eliminating vehicular traffic on those varying different streets for that. The third and last point that I'll make is that though we've taken these best practices, we've looked around the country and seen what works and what doesn't. We've also made sure that we've acknowledged where our inhibiting factors are, where our challenges are. And if I take 2 seconds for soapbox, we appreciate the steps that have been made in many of our larger cities. But down here in South Carolina, there's a complexity that comes with our transportation process that brings hurdles in the way that we have to be able to, through cooperation and partnership, make happen. South Carolina is fourth in the country in the amount of roads that are owned by our state DOT. Translation, for me to get a stop sign, I'm looking at an email right now. For me to get ladder crosswalks, I have to ask another entity permission to do so. When it comes to finances and the infrastructure dollars to make something happen by state legislation, all the sales tax money, even though Charleston and Columbia make up 51% of the state's sales tax dollars, goes to our counties. And we, along with our other varying municipality brothers and sisters, go to our particular counties to solicit funds for resurfacing, to solicit funds for particular projects and otherwise, right? There's not a transportation portion in our capital improvements plan, right? Because of the history behind it, right? And so as we're thinking about decision making, how we are dictating the public right of way, our hope is that in the national discourse and what reaches down here at the local level is credence that's given to the spectrum of cities and what they're dealing with, what they have to contend with, how they get to a yes, what type of supports that they need to be able to do that particular work of making our streets more accessible and opportunities for everybody, no matter what mode of transportation there are. So we're excited about what this will bring. We're excited about what this means for cities like us in the South, and where the work goes from here. So thank you.
Great, thank you so much, Keith. That was great to hear, and always makes me so happy to know you're down there doing such good work. So last, I have the pleasure of introducing Carlos Pardo, because so much of what we've seen in terms of really interesting people first transportation responses to COVID-19 have happened not just in the United States, but they've happened throughout the world. So we're really lucky to be joined by Carlos Pardo, who's part of the Pneumo Alliance. Carlos is a Colombian psychologist with an MSc in contemporary urbanism from the London School of Economics. He focuses on urban development, mobility, lighting, and climate change projects in cities of the developing world. He's participated in technical consultancies in more than 30 cities in Asia, Latin America, and Africa, and has coordinated and delivered more than 70 training courses on urban development, climate change, public and non-motorized transport, travel demand, and sustainable transport. He's also senior manager for pilots at the Pneumo, or the New Urban Mobility Alliance, where I've had the pleasure to meet him and really get to know Carlos's great thought leadership. So with that, we'll hear from Carlos on what's happening in his hometown of Bogota.
Hi, thanks for having me. I'm Carlos, and I'm coming to you live from one of the transportation meccas. And I hope that I can show you a lot of the things that are happening here. I'm here today with a very noisy neighbor, 2 children, 1 very active dog. So if you hear a lot of noise, it's them, but we're all fine now. Yeah, I need Cole to help me with the slide. So next one. While I see it. So I'm going to talk specifically about the initiative of having 400 e-bikes delivered to health providers in Bogota very quickly. But I could have also talked a lot about what Pneumo is doing in Seattle, in Detroit, thinking about doing in Pittsburgh, where we are structuring similar things, which are going to be actually much larger, but I have not so much time to talk about this. So next slide is, this all began with my excitement with doing a very quick hackathon, which took 4 days, and then it was right at the beginning of everything, on the 20th, the 19th, the 23rd of March, where we found that there were many things that we could do with the transport sector. And based on that, then I talked to one e-bike provider, which is sort of a public bike system, and I told them, would you be willing and able to put all your bikes to the disposal of the health sector? And they said yes. So we came to an agreement with them, and then we began doing this. So next slide. The hackathon had a few other conclusions, which I think now are pretty evident to everybody, but a month ago they were pretty novel. Sort of, please stay home. If you can ride a bike, please do so. Bicycles are wonderful. We should use them. Even now, it's even better to ride them. And if not, then use other modes, such as public transit, was sort of the summary of that. So next slide, I'm going to start talking to you mostly about this initiative of the bikes. We have a wonderful 550-kilometer bikeway network of permanent bikeways, fully segregated. That is, I'm very bad at miles, but I think it's somewhere around 300 and something miles. It's a lot. And then as of today, we have 80 kilometers of temporary bikeways, which last night our mayor said are going to become permanent. All of that is wonderful news. And then it makes it much easier to understand why we have such an easy time in doing these other things. Of course, the link that I have there isn't easy for you to click, but I'm happy to send links after this. Next slide, please. So based on this and based on, I'm going to show you a couple of pictures of how this is happening. This is one of the main avenues in Bogota, the Septima, the one on the left, and then the one on the right is in the southwestern portion of the city. That is the amount of people who are going by bike as of last week. As of today, it's going to be more people. So it is really fundamental to have these bikeways. So next slide, and then we can start talking more about these bikes that we gave. So these are the bikes. This is not a doctor. It was just that we needed a picture, and we said, can somebody put on like an outfit of a doctor, and then we just put the picture together. But then let's go to the next one. When it was PowerPoint, it had like an animation, so it was pretty fun to see that, but now it's irrelevant. This is what we showed to people just to tell them we're giving away the bikes. Let's go to the next one. But then you can see there also in the next one that so Numo and Despacio, which is an NGO, I should say a wonderful NGO because I founded it, but then I left. But then Numo and Despacio arrived at an agreement and funded Movo to provide these bikes to the different people and health providers. We agreed with government. That was a long discussion, but it was pretty quick, sort of in regular time scale of coordinating things with government. And we had to coordinate with the mobility department, the health department, the recreation department to do everything in delivering the bikes. There were 4 key locations throughout the city. Bogota is huge. We have almost 10 million people. I mean, having the 4 corners of the city with these bikes delivered was one of the big things to do. And one very important thing, we gave the bikes to medical staff, but we emphasized that they should also be given to people who are in other jobs. We did not want only the doctors to get these bikes. We also wanted the people who were cleaning the building, who were guards in the building, because we knew that they would also need a lot of these new mobile or free mobility services as well. 64% of the people who received the e-bikes were women. That was a wonderful stat that we found. 1 has been stolen. That's a pity, but that for Bogota is really almost nothing. And one of the lessons was there was a lot of mechanical support that we needed to provide them. These are actual people who did receive the bikes. This is an actual picture, so it's true. Go to the next one, please. I think some of the things that are relevant so these are some of the numbers, 16,000 trips in the month. The average trip distance is something around a little bit beyond 5 miles. You can see the map of the city and sort of a scale so that you can see where the trips happen, where these trips originated. So we actually are throughout the city. And the average travel time that we saw was 53 minutes. So that is a lot. And I think that's a mistake with the data because that's sort of strange. So go to the next one. I think that the next one is about giving them back. I know, so we asked a lot of people for help. So we were sending all these emails saying, can you help us? We did get help in data analysis. I'm going to show you a little bit of that later. And we did get support for bike maintenance. We didn't get so much support of all the other stuff. We wanted this to be like 1,000 bicycles or 2,000, but we really didn't get there. But we did ask for a lot of this. And then the next one should be showing you a little bit of the lessons, I think, or giving them back. So can you go to the next? So I'll start telling you because I guess I know this by heart. We began they could get mechanical support for their own bikes, so they can continue using bicycles, not these e-bikes, but their own bikes. And then the third thing was that people were really happy anyway. Like, we started to send these WhatsApp messages, because Bogota is all about communicating through WhatsApp. But when we started to tell them you have to give it back, then they said, well, thank you, this was wonderful, I love it. Okay, so this is the survey that we did. It is incredible that when we said, what would you have preferred to use? A third of people said, well, the e-bike, like exactly what you gave me. So that is very nice. If you go to the next one, it is another question that is related to when they would use the bike, depending on the shift, and then 60% said it doesn't matter. But then morning was a third of people. They basically said, well, if it's in the afternoon or in the evening, then I just won't use them. Go to the next one, and that is, I think, the last question of the survey that we did, and it is coming. But anyway, so we asked a lot of questions. I mean, I guess we can share these slides later for those of you who would like to see this in greater detail, who would like to see the data set and then combine it. But then there's a few more results which are pretty interesting, and it's about how people said they would continue using other modes. So if you can go just to one of those slides of the end, which are saying how people are moving from, for example, using a bike to, or using more bike, or using the transit system, which is Transmi at the top. They are going to ride their own bike from now on, or they're going to be using a micromobility app, or they're going to be using a car to an extent. So these kinds of things we're starting to see, and they're really interesting. But I ran out of time, so I'm happy to stop now and then take everybody's questions either now or through Twitter or through any other channel that we create.
Great, thank you so much, Carlos. It's so fun to see what's happening down in Bogota. It has long been on my list of places I want to go and just ride a bike around. We just have a few minutes for questions, so if the speakers who are still with us want to come back on camera. I believe Robin did have, oh, Robin is still there for just a second. Robin, I think you're on mute.
Why do we always do that? It's like we don't learn from minute to minute.
Oh, I know, and I've done it like twice.
I apologize. I do have to sign off right at 1:30, so I have a minute or two. But if I drop off, my apologies for not being able to stay a little bit later.
Great. Well, maybe I'll start with a really quick question then for you, Robin. It's not a quick question at all, but I can ask it quickly. How do you plan on, I know you talked about leveraging this for long-term change and realizing your plan, realizing your larger transportation plan. How do you have any strategies or thoughts about how you're going to do that? That was a common question for you, is how are you going to leverage these short-term changes into long-term infrastructure?
I think there's two things that we're going to focus on. The first is the elusive behavior change. It's elusive for everyone. It's part of our profession. Very difficult to do, really easy to say. But I think these local traffic only streets and having people go out and experience what it's like to be on a quiet street, to be more secure in riding a bike or having space to walk, will hopefully demonstrate to people that they can change their behavior, and that will hopefully stick. And the second way is that we are making a list of projects that we are going to be able to do this year that are maybe catalyzed by the COVID conversation, but there are things that we want to do, they're in our plan, and perhaps we're going to accelerate.
Great. Thank you so much, Robin. And I know you have to leave, so thank you.
Thanks. I'm sorry. I would love to hear the other speakers' response
not at all, but people just loved you. Really good thoughts.
So and I really love them back. Thank you for this opportunity. Let's keep learning from each other. Thanks so much.
Thank you. Great. Well, the next is a question for you, Mike, but Keith might be able to add to it as well, which is, we loved it. People loved your typologies. Are you seeing any trends in terms of different geographic regions, either in the United States or around the country, maybe the Sun Belt. I know Keith had mentioned, what we're seeing in the South versus the rest. So maybe I'll ask you, Mike, first, and then Keith, if you wanted to add in.
Yeah, quickly. I mean, I think we were seeing a number of the smaller cities are doing more of the pedestrian signal recall. It seems to be in the capacity of existing staff, at least on local streets and local signals. It's pretty low-hanging fruit. I'd say equally with the open streets in smaller communities, it's, we've got communities of, 20, 30, 40,000, some of which are not doing, 25 miles like Burlington, but are going to that pinch point in their active transportation recreation network and saying, on this bridge, which connects two sides of a river, we've got a very narrow sidewalk. So here we actually have to take a lane away, and maybe it's only 0.1 mile long, but it's providing that really needed release valve at a pinch point where people are becoming more and more active as it gets warmer. So that kind of trend is like definitely in the smaller communities, I'd say, in terms of geography. The West Coast is doing pretty well on the kind of shared streets idea, from Salt Lake City to Oakland to Seattle to Emeryville to others are like, look, we've got these bike boulevards, these neighborhood greenways, and now we can catalyze those and make them, one, expand our program, or take our streets that we want to be in that network and fast track them, or we have those streets and so we can further decrease through traffic on them now with this opportunity. So that's been really interesting to follow and to see happen.
I'll just follow up and just say real quick, it's really about the how. I said this before we got online, one of the biggest lessons coming locally from being at the national level is that, the 3-step plan, the 6-step plan doesn't apply, and there's inhibiting factors or challenges that are always there, right? You think about a state like mine, one of our top 5 cities and an amazing partner on a lot of things we do, North Charleston, which is right above us, top 5 city, doesn't have a Department of Transportation. Right. So when you talk about what does implementation look like, right? We can't just assume that this is the cookie cutter way that this will be applied and make sense, right? And so I think that there's a need out there of thinking differently about the public right of way. I think the general public and citizenry want to be able to see that. I think at the city level, municipality level, it's about the how. And what exactly does that look like? And I think as we're engaged in these national conversations, how do we ensure that the discourse identifies what the solutions look like for cities like mine that have to have monthly meetings with the state DOT staff, with the county staff, and thus coordinate together about, sidewalking, right? And how that looks, and how do we take these tenets and best practices that other places are making happen and squeeze it into what makes our neck of the woods unique, and still be able to get to that ultimate goal of people, no matter what mode of transportation they're using, feeling safe within the public right of way.
That's great. Thank you, Keith. Carlos, the next question is for you. And this can apply to your work in Bogota, but also in, I know the other cities you mentioned, Detroit, Seattle, Pittsburgh. What can advocates learn and do about leveraging the short-term changes into long-term impact, specifically with focus on equity? So I know you really work to get these bike shares up. I think NUMO works closely with cities and advocacy groups. It's a similar way of thinking about Robin's question, but from the advocacy and NGO perspective.
That's a great question. I mean, I think we can do things, and it is exactly the moment to really try. I mean, one of the things that I was thinking as I was listening to everybody was there's 2 things that I have seen much more than in any other effort that I've been involved in. One is the openness of data and information. I mean, if you look at what Mike has been leading in his own spreadsheet, it is wonderful how you can already see a lot of information. And this is happening in many different places, including in government. So having access to that information can give people much better arguments to promote one of these solutions. And I think that is what is happening in many of the cities in the world when they say, well, look, I talked to these people from this other city and I saw this data and I couldn't find that it is perfectly demonstrable that we can do something. And the second thing is that I'm very sincere. So I have never liked working with government lawyers, but in this past month, either they have learned to like me or I have learned to like them, because we have really moved forward. And it's like, I've had meetings where I'm like, we have to do these 5 things. Because after the 400 bikes, I've been helping with 30 different initiatives for the Bogota government. And the lawyers 1 month ago were like, yeah, we can't. And then a couple of weeks later, they were like, okay, so the way that we're going to do this is the following. And that has never happened in the past year. So I think we have that chance as people who are working outside of government to really push forward very decisively and having people pay attention. That did not happen before. And I have done many of these things. And this is the first time that I can really say, you can really move forward and they will pay attention because they're all freaked out and we can help them, basically.
That's great. I know we're way over time, so I'm just going to ask each of you, is there one thought or action you'd like to take us away? And also, Mike, I actually got a lot of questions, if you can share this in your answer, about what a signal recall is. That was a common question that came up. So I think from all of you, what's one action or thing we should take away from this, either to ask our city to do, to research, to sign up for? And then Mike, if you could also answer signal recall.
Signal recall. So basically, the pedestrian actuation button, the whole thing you have to press on the pole to get a signal. In many places, you have to press that button to get the signal, otherwise it won't come. So cities have disabled that or altered that so that the pedestrian signal recalls. It comes on every signal cycle so that you don't have to press that button. A tiny innovation that I think we can hopefully see become permanent in most of these cities moving forward. One action to consider is, look, we're all in this mess right now. It's extremely challenging. To Keith's great point, it's different everywhere. But at some point, we have to stop thinking about the emergency of now. And as things become hopefully better, shift our mindset and shift our thinking to what we learn from this and how we embed what we learn into policy and practice moving forward. So I think the big opportunity for cities are, those that really struggled with getting cones, even though they had the political will to do it, or those who didn't have the political will but had the materials, to find ways to take on a new approach to transportation in the public realm, and that it's as important, if not more important, to do it, all the time, but also have that resource and that muscle to flex during an emergency or crisis like we have right now. So it needs to be almost like an urgency at all levels, all the time, to be prepared for that, and just hope that things go back to normal, and hopefully we don't have to do this again. But we don't know, and if we don't know, we need to be prepared.
I guess I'm next in the line. I think the thing that I would say, coming from the non-traditional background into this position, from advocacy and from policy, that your advocacy matters. For decision makers, they know that if they're hearing a groundswell that this matters and this makes sense to move on, that they have to give an answer, right? No matter what that answer, they have to give an answer. And so, and when I say advocacy, I'm not just talking about from our traditional advocacy groups. I think there's a strategic role that our consulting groups and otherwise professional services can play. That's not just about waiting for the next project to come up, but it's speaking truth to power about what our streets should look like and being unafraid to stand up there and say that, we need your voice in that conversation too. You've seen what happened somewhere else in some other state that you're working in. Why can't that happen here in South Carolina, right? And so your advocacy, it really matters to pushing the needle forward, because it encourages the decision makers that this is something that makes sense, right? This is something that they need to engage in. And so encourage you all to do that.
And then I guess I'll close with, I think it's fundamental to people to get information and collect it and share it as best they can. Again, like what Mike was showing is a wonderful example of how this crowdsourced information is now very nice summaries of how this is happening across the world. I think a lot of that can be done already. We are doing our best to promoting, like we have a survey that anybody can use. I'm giving away every data set of what I've been doing for anybody who wants it. And I think we should all do this. And then I think that is linked to another thing. We the ones who are here still, there's 478 people who are still here. I'm sure that you have a lot of ideas from before. They're perfectly applicable to now. It is surprising how it's basically the same rules that we've all been talking about for the last 20 years. So just pitch them and just say, yes, we can do it. I mean, let's read the NACTO books and then let's see. And then let's go to the Smart Growth COVID-19 website, which has a bunch of this information. What's the last thing I wanted to share?
Great, thanks so much. Thank you all, and thank you for to our three speakers who are left, and to Robin for going a little over time. I think people are so eager to get your information and hear about your creative ideas and leadership. To those of you who are listening, we did record this and we'll share it with you. We will share how to get a hold, the Twitter handle or websites or emails of each of our speakers. We'll try to answer some of the questions. Some of them were somewhat, I think I can answer, and some of them I'll turn to some of our speakers because there were far more questions than we got answered. But thank you again. This was really inspiring. And I think it will really leverage into more ideas, more innovation, and really more streets for people. So thank you all, and we look forward to seeing you soon. And again, we'll send out an email, or you can catch www.smartgrowthamerica.org for a copy of the recording. Thank you.
Thanks, bye.
Goodbye.